Blake's Taker here with Columbia Chiropractic. Today I'm going to show you my favorite way to help old ankle injuries. For me myself, I sprained my ankle 11 times, so a good bit, and I have a lot of residual scar tissue, and the scar tissue actually starts to cause spurring around the ankle where the ligaments tie in. When you have that scar tissue, it pulls and causes a spur, and that stops and decreases the range of motion, as well as I have a lot of old residual swelling in here. So I found that by using, it's called voodoo floss, you get it from Rogue, that it really helps to break that up. So the rationale is first you take it, you're going to wrap it around the ankle. You want to overlap it about an inch there. And the tension is going to be about 50 to 70%. And the rationale is this band, as it tightens, you're going to put the band on here, and you're going to put your ankle through a range of motion. And this band is going to help to pull apart all the adhesions through there. And the compression is actually going to squeeze the fluid out of the ankle and push it back into your circulatory system. And then when you're done through the exercise, when you take your band off, the blood then flushes in to help the circulation. So we're going to wrap it. Like I said, when I say 50%, like that's 100%, you pull at about 50% tension, 50 to 70%. This is also really good for heel spurs, because when your Achilles gets tight through here, it's going to pull and cause spurring. So this here is also going to cause tension through here and kind of floss away those adhesions and loosen up the Achilles. And once that's loose, it's going to stop pulling and help with that heel spur. So you're going to wrap it. You just kind of tuck the remaining bit right through there. Now first I like to use a mobility board here. You're just going to do rotational exercises just like this. When you first start, you have to put your full body weight on it. Just going to rotate 360 degrees both directions. And that's just going to kind of floss the ankle. Where that band tension is going to just pull apart all that scar tissue around that ankle, and the compression is going to pump out that swelling. So I just rotate both ranges of motion. I like to do it until it really starts to burn. And then we'll do a simple calf stretch. Just like this. Make sure you want to flex that arch. Keep this arch tight here, because you want to keep this tight. And you want to really focus on stretching the back here. Just going to step forward all the way. Demonstrate here. Keep the foot tight. Use that to really stretch the calf, primarily the gastrocnemius. And then you can once again go back to kind of flossing the joint. And the next one here is to really stretch the Achilles and that soleus. You're going to put a band right here on top of the tibia. What you do is when you slide your foot forward, the band actually pulls the tibia back. Like I have a spur right here, and this pulls the tibia back off of it, and so I can get full range of motion with my ankle. And I sit and hold that, and that really is going to pull and stretch this back part here. And when you do a stretch like this, you want to do it for at least 2 minutes, and that's going to make a permanent tissue change. That's going to really help with your ankle flexion. And once again, keep that arch tight because you want to stretch the arch. A lot of times I actually put something like a towel or something here in the arch to kind of maintain it. So once again, you get tension. You can get these bands here at Rogue, you can get them at Westside, you can get them at Elite FTS. And that's kind of, I'll show you here. This is your tibia, this is your foot. Like for me, I have a spur there, my foot doesn't flex up all the way. The band pulls that back and lets that stretch all the way forward to stretch out the Achilles in the back of the ankle. Just like that. So you're done. Just pull off the band. And that compression is not allowing the blood to flow. When you take it off, the blood just flushes in, helps clear out that inflammation. Aside from this, if you're doing this and your foot's going numb, you want to take it off. It's probably too tight. Max time you want to keep this on is probably about 3 to 5 minutes. So give it a try. Hopefully it helps you guys out.